At Dr. Sellars Educate, we help nurse educators and leaders advance their skills, pass the certification exam, and achieve excellence in nursing. Whether you're preparing for the CNE, CHSE, or CNML exam, our coaching programs, masterclasses, and study resources are designed to help you succeed with confidence. We provide a NCC-accredited continuing education, faculty development workshops, and practical strategies to strengthen teaching excellence, simulation, curriculum design, and accreditation readiness. We partner with schools of nursing and healthcare organizations to support faculty development, certification initiatives, accreditation preparation, and educational excellence. More than 5,000 educators have trusted Dr. Sellars Educate to support their professional growth and certification journey. Visit us to learn more and join a community committed to excellence.
Simulation can be a very effective strategy for our students to have this deeper understanding of concepts that we need for them to have. This is only going to happen if we have clarity around what framework we're using for simulation, as well as debriefing, and what are those clinical learning outcomes that we want our students to achieve? How are they aligned with our learning objectives for that specific learning content that we need to have aligned with our courses? Welcome back, everybody, to Dr. Sellars Educate. We're excited that you're back. These are some questions that we're going to dig deeper into. Most importantly, if you haven't already, go ahead and pull out your study worksheet. So every time you show up for a snapshot, we want you to have that study worksheet in front of you. It's listed right here in the description. We want you to write down, what is the takeaway that you want to have at the end of our time together today? What deeper learning do you want to have as a result of our conversation? Second of all, we want you to write down today's date. Whatever date you're watching the snapshot, this is going to increase your accountability so that you can reflect on what your journey has looked like. If today is the first time that you're watching one of our snapshots, we are delighted. You will see every single week we're using Billings and Halstead Teaching and Nursing to go deeper in a specific concept. And we also engage in a thought-provoking question. We actually have two for our conversation today, so we're excited to explore content related to simulation, evidence-based practice. How does this also align with your accreditation? I know many of you all are on the journey to either go through your first accreditation or a reaccreditation. We want to gather as much information about our student population, evidence-based practice, and align it with the standards so we can have a very smooth transition into our site visit. So let's go ahead and take a look at our content as we explore this really important topic, talking about simulation. How do we engage our students? How do we have this deeper understanding of the knowledge that we need, not only for our students to have, but also for us to have? And then why is it important? Why is it important that we use simulation in our learning experiences with our students? Our devotional for this snapshot is aligned with day 15, the joy of learning. This is from our devotional, Rooted in Wisdom. You can also find that in the description. Mahatma Gandhi says, live as if you were to die tomorrow. Learn as if you were to live forever. Education is a lifelong journey, not a destination. As nurse educators, we must stay curious and open to new knowledge, just as we encourage our students to do. When we embrace lifelong learning, we continue to evolve and improve our practice. We talk about lifelong learning. There is a pioneer that we often refer to, and his name is Malcolm Knowles. His work is all centered around lifelong learning, us being self-directed in making decisions about what our learning should look like, understanding what our gaps are, but also having that increased accountability so that we can map out our plan to have a deeper learning of a concept, as an example, or maybe we're exploring a new concept that we are not as familiar with. Our first thought-provoking question: a nurse educator is developing a simulation on the early recognition of sepsis. Which action best describes alignment between simulation and evidence-based practice? A, including multiple complications to make the scenario more challenging. B, designing the scenario cues and expected interventions using current sepsis guidelines. Or C, allowing each faculty member to determine which interventions students should perform. You can pause this snapshot if you need to take some time to process the correct answer. And then when you're ready, you can come back. When you get to the CNE exam, You can expect a scenario just like this one to be included in the STEM. And then you'll have three options. Only one option is correct. You want to think about, what is this question really asking me? And second of all, what is it that I know for sure about concepts in this question, especially if you have no idea what the question is asking you? Okay, there may also be a distractor in that STEM. So if you chose B, designing the scenario cues and expected interventions using current sepsis guidelines, give yourself a round of applause. Here's the rationale. Evidence-based simulation begins with current research, clinical guidelines, and standards of care. Scenario cues, expected decisions, interventions, and evaluation criteria should reflect the same evidence. Increase in difficulty without a clear purpose does not ensure alignment. And inconsistent faculty expectations reduce reliability. If we are telling students different things, from our clinical faculty to our SIM faculty, even to our skills lab faculty, students are going to be confused. So we must be consistent in our practice by using those cues. That's a really important part of the learning journey for our students to develop critical thinking and to advance their clinical judgment. So what's your number? How did you do with that thought-provoking question? 1, you felt lost. You had no idea what we were talking about. Or 5, you feel like you're ready to teach. And you could have easily taught that information. All right, so write that down where you are on that scale, 1 to 10. The next point we're going to make are 3 key elements that you should take away regarding best practices, not just for simulation, but also how we think about our curation of the learning experiences that we are developing with our students. Remember that we are partners with our students on this learning journey. So that's exactly what we want to do. We want to think about, how can we partner with them to help them have a deeper understanding? What should those teaching strategies look like? We want to get that information from our students too. Simulation isn't the evidence. Aligning simulation is our goal with those evidence-based practices. I had a great conversation with the director recently, and we talked about a lot about what's happening in nursing education. One of the key elements, though, that she's always focused on, even when I work with her as an adjunct, she always focused on creating not only realistic experiences, but also thinking about, how do we align those SIM experiences with the evidence, with our learning outcomes. She's never focused on high fidelity necessarily simulation. It's more about, how can we create the richest learning experiences with our students. So I'll tell you best practice that she continues to have, that she brought into her new university once she received a promotion into her new college. She now uses more standardized patients for simulation. She's also opening up other campuses, other sites, and that is a culture of what her beliefs are. Her culture of building a really rich nursing experience for our students is to make sure that we're creating not only realistic experiences, but also, how can we truly engage as a partner with our students to support that learning journey? And we know standardized patients, once they go through the training, which they should do, they can become excellent experiences. They can create excellent experiences for our students because they give them a lot of feedback, right? And they're able to also, we as faculty are able to recognize those cues, maybe that students have missed, or may consider adding more cues into the simulation experiences that we are creating for our students. So that's number 1. We want to remember that simulation isn't the evidence, right? Those high fidelity mannequins, that's not what the evidence is about. It's about creating those rich learning experiences with our students so that they can walk away having this deeper comprehension of knowledge that we need for them to have. So key takeaway number 1, we want to begin with the evidence, not the technology. The evidence is going to be going to the literature, whether it's a NACSL standards that we're following, looking at the different frameworks that we should have for our debriefing model, making sure that our faculty are properly trained, making sure that we have the technological experience that we need in our SIM experts so that they can troubleshoot. We shouldn't be asking nurses to really perform at a level of a technician, because let me tell you, those high fidelity mannequins, there's a lot of technology, and we want to make sure we're using them properly and that we're troubleshooting adequately. So making sure we have a good fit between the actual colleague that is doing the work and the expertise that is needed. Second takeaway is aligning every component of the simulation. We have to look at what the scenario is going to really help the students have a deeper understanding about. If we are using the evidence, which we should, if we're using the evidence to really craft our scenarios, or we're pulling from the evidence what our scenarios are going to be, which is, again, a great best practice. That way, we're not questioning whether or not our scenarios are really effective and really aligned. This is going to help us create richer learning experiences for our students. So that's what we want to remember, is we want to make sure we're aligning every single component. Number one, the scenario to the actual evidence. That means that if we are creating our own, that we know what that framework should be. Number two, that we're looking at those outcomes. What is it that we expect our students to learn? Okay. And then number three is going to be our specific student learning outcomes and our programmatic learning outcomes. How does it all align? When we look at our learning outcomes, we also want to think about our learning objectives and how they align with the actual course. And then number three is we want to use debriefing to connect the evidence with our clinical decisions. Debriefing, some would say, evidence would say, is one of the most important parts of the simulation experience. When we think about debriefing, that's when the light bulb moments happen. That's when our students are able to truly validate their deeper comprehension of knowledge. Or maybe we've opened a loop and students are now even more confused about a specific concept. This is what we want to consider. Number one, again, a recap. I want to start with the evidence. Let's make sure we understand not just the technology, but that we understand the scenario and the objectives and outcomes. Number two, that we're aligning those objectives and outcomes to every component of the simulation. Which simulation are we going to use? Are we pulling it from a vendor relationship that we have, a textbook vendor, or maybe the equipment vendor that we're using for simulation? Remembering that simulation does not have to include a mannequin, right? As I mentioned, there's a wonderful director who has years of experience, who has a standard. She's established a culture of excellence related to enriching that simulation experience, and standardized patients is where she has seen for decades now the richest experience for students to have. And then number three, making sure that we're taking the time, number one, to adopt a debriefing model based on the evidence. Number two, that we're actually training our faculty about that, what that model should look like. When I always align that skill set needed with the right talent, making sure we have the right person in the seat and that they have the right knowledge. They're equipped with the knowledge, with the resources that they need, and support, of course, that they need to create these rich learning experiences for our students in simulation. Okay, and then as we wrap up, I promised you all a bonus, so that's what we're going to do. And this is related to the actual thought-provoking question. Hopefully you all could see all of those points. Let me go back and make sure that you could. All right, if you're a visual person like me, that's a really important part, right? All right, so hopefully you can see these 3 points. I'm going to show them on the screen one more time. Number one, we're beginning with the evidence. Number two, aligning every component of the simulation. And then number three, using debriefing to connect evidence with clinical decisions. All right, so those were our 3. I'm using Prezi again today. I really like Prezi, but sometimes, as you could see, it does blur out the information. So you just have to be careful if you're going back and forth with Prezi and Zoom. All right, so hopefully you all can see this presentation that we're going to wrap up with. Now I'm flipping back to Canva. All right, so our bonus thought-provoking question. The outcome of a simulation states prioritize nursing interventions for patient experience and clinical deterioration. Which evaluation method is best aligned with this outcome? A checklist documenting whether students completed every psychomotor task and understood the rationale. B, a post-simulation quiz requiring students to recall the signs of deterioration with the rationale. Or C, a rubric evaluating cue recognition, prioritization, evidence-based actions, and reassessment. All right, let's see what you thought. C is the correct answer. A rubric evaluating the cue recognition. As I mentioned earlier, that's a really important part of students' journey and making sure they have that deep understanding of knowledge that we need for them to have. So if they didn't recognize those cues, maybe we need to add more. Or maybe we get feedback from students after our debriefing is completed, because remember, students should also be doing an evaluation of their simulation experience. If that's new information for you, that's okay. Remember, this is a judgment-free zone. Go back, look at the NACSL standards, look at the practices that you have adopted, and make sure they align with the evidence. And then the other part we mentioned is not only may there be an opportunity to increase the number of cues, but maybe it's the timing of the cues, or maybe it's that they are too subtle. So just making sure that we are evaluating the cues that we're providing to our students. The verb prioritize requires students to demonstrate clinical judgment, not simply recall information or complete tasks. A rubric that specifically measures based on our evidence-based practices for how we use a rubric and develop it. It measures recognition, interpretation, prioritization, action, and reassessment. That's going to provide the strongest alignment with the stated outcome. When you get to that C&E exam and you're looking at that question, remember, it's not just about the question, because 80% of the questions on a C&E exam are going to be at that application analysis level. So it's not just about the question, it's about understanding what the question is truly asking you. So yes, when you read the question, which we want you to read every part of the question, don't assume if you start reading the beginning that, oh, you know what the answers are. No, we want you to fully read that question. And then we want you to go deeper into analyzing that question and having clarity about what the question is actually asking you about. Because in that STEM, especially in the latter part of the STEM, sometimes there's a distractor, okay? This is about a transformational experience. We're engaging in a transaction. You're exchanging your time for information. But the most important part is that you're starting to think differently. You're starting to think like a nurse educator so that we all can create richer learning experiences for our students. Professor Camp is one of our colleagues that we are celebrating in the snapshot because she achieved C&E success on the C&E clinical exam in just 60 days. She committed to the 60-day program that we have, and she says that the C&E in 60 days prep course added the structure and social element I needed to meet my goals and pass the exam. What I appreciate the most about Dr. Sellars Educate is the level of care taken to help guide you to identifying your gap areas and where to begin closing those gaps in the resources. I also appreciate that the recommended resources list wasn't exhaustive, and our resources I'll continue to use throughout my career. Well, we appreciate Professor Camp being committed to nurse educator excellence. That's what this journey is all about. How do we get just 1% better every single day? We are excited to invite all colleagues to join us on the C&E in 60 days journey. The only way you won't be successful is if you quit. When we consider simulation, it is a great evidence-based practice to integrate into our nursing curriculum. There are just some pointers that we want to remember to ensure that we are creating the richest learning experiences with our students. We hope this snapshot has been helpful, and we look forward to seeing you in the next one. Have a great one, everybody.